for MPN patients, I think the biggest challenge is that these patients have big spleen. And patients with big spleen after transplant with a myeloablative regimen, they do engraft, but we do end up with poor graft function. And what I mean by that is their neutrophil or platelets or white or hemoglobin are lower and they are transfusion dependent, and uh, and this can go on for a long period of time. In fact, poor graft function is present at day 100 in about quarter of the patients. And to fix that, we think shrinking spleen aggressively with the conditioning regimen may be the way to go. So what we are studying is adding high dose ruxolitinib, 100 milligrams a day, as a part of conditioning regimen. And that, I suppose, if we can optimize that, that may help further improve outcomes.